ஆமா எல்லா மீட்டிங் போறதுனால எம்சிசி ஒன்று இருக்கு, எஃப்சிசி எதுவும் இல்லை. நான் நெருக்குள்ளே வச்சிருக்கேன். ரிப்போர்ட் புக்கில் தான் நாமினல் வச்சிருக்கோம். அப்ஸ்காண்ட் பேசிட்டு
Hi, hello, good evening. Myself is Priya Krishnan from Smart Fruit Academy. Can I get a response? Am I audible or not? So I'm going to deal with the pediatric nursing and my specialty also in MSc pediatric nursing. So today we just have an introductory section regarding the pediatrics. So first, as an introductory, I think you all know about what is pediatrics. So pediatrics means it's a branch of medicines or a science. So mainly it deals with the medical care of infants, children, and adolescents. So our specialty means what's the specialty of the pediatrics is we are taking care of the children of a particular age group only. That is from birth to 18 years. So that's why it's specialized. So it's a branch of medicine. So we are taking care of the child, medical care of infants, children, and adolescents. If you are telling a child age limit, it will range from birth up to 18 years. So it's derived from two Greek words, pediatrics, which is derived from two Greek words, that is Paed and iatros. Paed means child and iatros means doctor or healer. So hence we can say pediatrics, which means healer of children. So it's derived from Greek word Paed and iatros. Pediatrics means healer of children. So pediatric nurse means same thing. And one more thing, a medical practitioner who specializes in this area, we can call it as a pediatrician. And pediatric nursing means it's a medical specialty, pediatric nursing. So we are giving promotive, preventive, as well as curative, emergency, all the care giving for the children from birth to age. And the important point is that the father of pediatrics is Abraham Jacobi. So you may get a question like, who is the father of pediatrics? So father of pediatrics is Abraham Jacobi, and the first pediatrician in India is Dr. George Coelho, and he is known as the father of Indian pediatrics. So the father of pediatrics is Abraham Jacobi, but the father of Indian pediatrics is Dr. George Coelho, and he's the first pediatrician in India. And one more thing is Dr. K.C. Chowdhury, who founded the first independent pediatric journal, that is Journal of Pediatrics, that is in the year of 1933. And the IAP, that is Indian Academy of Pediatrics, which is founded on 1963. And the father of modern pediatrics is George Armstrong. So three more important points. First one is the father of pediatrics, that is Abraham Jacobi. Father of Indian pediatrics is Dr. George Coelho, and the father of modern pediatrics is George Armstrong. These are three important things here that we have to give more important consideration. So next we can see some of the terminologies which is coming relating to the pediatrics. So as we know, growth and development, from the BSc nursing itself, we are dealing with the growth and development. So what is growth? It's simply just increase in the size of the structure, whereas the development is the maturation only. So what all the structures are increasing in their size? So in development, maturation takes place. And cephalopodal as well as the proximodistals. These are the two important principles which we are dealing in the growth and development. Cephalopodal means that the progression is from head to toe. So first the head will be mature, then the toe will be. That is, if you are taking an example, means in the case of infant, when we are dealing with the growth and development, first the infant attains a head control at the age, at the month of 4 to 5 months. And then only at the end of 12 months only the child is able to walk or stand at least with the support. That's so cephalopodal. So the development is from head to toe progression. Then proximodistal, which means trunk to periphery. The progression is from trunk to periphery. That we can see like the grasp, pincer grasp. First, the infant posture is flexed, and then only it is progressing to pick a single, that is by the age of 9 months only the child is able to pick a single object. Next is the phylogeny as well as the ontogeny. Phylogeny means it's a development or the evolution of a species or group. Again, simply we can say it as a pattern of development of a species. It's a kind of pattern of development of a particular species or a group of organism. Whereas the ontogeny means it's a development of an individual within a species. So phylogeny It's a pattern of development of a particular species, whereas the ontogeny, that's the development of an individual, a peculiar individual within a species. That's the difference between phylogeny. There is a group, phylogeny, group of people, ontogeny, single person within a species. So that's some of the important terminologies that I have to keep in mind when dealing with the pediatrics. And next one is the growth and development. In that stages of growth and development, we know that intrauterine as well as the extrauterine. Intrauterine means the life inside the womb, that is from the conception till the maturation of full fetus. We can say it as 40 weeks. And extrauterine means out of the womb. So that is from birth till the death. So the intrauterine, we can have a division of three, like a zygote, embryo, and fetus, which means zygote means from after the sexual intercourse, conception, when he is conceived from the 0 to 2 weeks, we can call it as a zygote. And from 2 to 8 weeks, we can call it as an embryo. And from 8 to 14 weeks, we can call it as a fetus. That's a matured. That is the 18 to 14 weeks the periods of maturation and rapid growth. So these are the intrauterine life, zygote, embryo, and fetus. And extrauterine means after the birth, the baby is known as neonates. So birth up to 28 days, we can call it as a neonatal period or a neonates. Whereas the neonatal period we can again classify as two, that is early neonatal period as well as the late neonatal period. Early neonatal period means from birth till first 7 days of life, we can call it as early neonatal period, whereas late neonatal period means from 7th day to 28 days, we can call it as a late neonatal period. That's a two different categories of neonatal period. And then from the 29 days up to 1 year, it's infant, 1 to 3 year, it's toddler, then 3 to 6 year, it's preschooler, then 7 to 12 it's schooler. So here we have an exception, like if you're taking in boys, from 6 to 12 year is the preschooler age, whereas in girls it's 6 to 10 year is in the schooler age. So there is a difference in schooler age of both boys and girls. And from 12 to 14 year, it's early adolescent. The adolescent period, which is again classified as early, middle, late adolescence. So 12 to 14 year, it's early adolescent, and 14 to 16 years, it's middle adolescent. Then 16 to 20 years, it's late adolescence. And above 20 years, it's adults. Or above 19, we can call it as an adult. Till 19, only teenage period is taking place. So these are the extrauterine life. So next is differences. So if we have to go in depth regarding the pediatrics, first we should know what are the differences between the adults as well as the pediatrics. Like childhood, we know that childhood, it's a period of rapid growth and maturation. Whereas if we are when we are reaching the adulthood, our complete growth is happening as well as the maturation also happening. So once a person is reaching the adulthood means he completed, and then next is like aging only. So that's the main difference. And when we are looking into, so we can see it as like a different anatomical, physiological, each wise we can see. In anatomical section, simply we can say size, as we know that child is very small as well when comparing to the adult. So in size, head of the baby is greater in size as well as weight when comparing to the body as well as the length of the baby. That's an important difference. And next one is in skull, the sutures are not united. We know that we are having two fontanelles, anterior fontanelles as well as the posterior fontanelle. During the neonatal period, both are opened. So these areas, like fontanelles areas, the brain tissue in the fontanelles are not protected by cranium. That's opened. That's why in case of hydrocephalus, it's bulging. bulging the fontanelle and as well as in the dehydration, it's depression of the fontanelle that we can easily identify since the fontanelles are not covered by the cranium. And in the eyes, as like a pediatrics, all these structures are immature. So if you are going in a specific means in eyes, all the types like lacrimal glands and ducts are structurally incomplete and the function also immature, as well as they don't have tears also. That's why they are more prone to get eye infection. In nose means their nasal passages are very small, as well as the septum also very thin. And mostly they are nose breathers up to 6 months. That's why if any respiratory infection is happening, a child may have breathing difficulty because their nasal passages are very small, and from the infection, of course, there will be secretions will be there. So that secretions will uploading these small nasal passages, and that will result in the apneic episodes or dyspnea or breathing difficulty. And in the oral cavity means when comparing the tongue, the oral cavity is very small and the tongue is very large. So there is a high risk of obstruction of the airway by falling back of the tongue. If the tongue is falling back means the airway get obstructed because the oral cavity is small than the tongue. And as well as one more thing is that the newborn's first suctioning means immediately after birth we are suctioning the oral cavity only because it's containing secretions. And in stomach, when in for adults we are having both the cardiac and pyloric sphincters are more well developed and more functional. But in case of child or a neonates, the cardiac sphincter is more relaxed. That's why there is a high chances of regurgitation will be there. And in case of eustachian tube, eustachian should be when comparing to adult, it is short and which is more horizontal in an angle when comparing to adult. But in adult case, it's a slanting line only. And one more is it is more close to the throat also. That's why the pediatrics or the babies are more prone to get upper respiratory tract infection as well as ear infection. So we know that when we are dealing with the cases in the casualty or in the ward, more childs are coming with the upper respiratory tract infections. So if the child is having upper respiratory tract infection, there is a higher risk of getting otitis media because these eustachian tube is short as well as which is more proximal to or close proximal to the throat. So there is a high chance of spreading of infection from the throat to the eustachian tube. And in physiological functions, if you are looking in the physiological functions, remember that is basal metabolic rate, which is high in newborns because the in neonatal period means it's a period of rapid cell growth and they are having increased requirement of they need a more energy for production of heat and there is a rapid energy consumption also when comparing to the adult because we know that in neonatal period that is more they are more prone to get hypothermia, hypoglycemia, all those things. So the newborn baby itself, its body itself need means more energy for overcoming all those actions like all the mechanisms, all the functional mechanisms, respiration, elimination, everything. So their BMR is very high. And when in the regulation of body temperature, they are more prone to develop hypothermia because their body surface area is very large and their hypothalamus is immature and the control effector system of the thermoregulation is immature. That's why they are more prone to develop hypothermia during the neonatal period. And one more thing is that they don't have that sweating as well as the shivering mechanisms if they are exposed to cold or hot. That's one more thing, that one more reason for hypothermia. And in the fluids and electrolyte system, so in babies, total body water is 750 ml, whereas in adult it is 550 ml per kg of body weight. And the 75 to 80% of body weight is comprised of body water in case of a neonate or a baby, whereas in case of an adult, it is 60% only. So in baby's body, 80, I think, about 3/4 is water. And they are, so if the perspiration is increasing, there is a high risk of dehydration also. And in the cardiovascular system, in heart sound, it is high pitched and greater intensity during the infancy period. And their heart rate is 140 to 160 BPM, whereas in adult, the heart rate will be in a range, if you are saying a range means it will be 60 to 100. And in the hematological system, babies are having large RBC, and the lifespan of RBC means 2/3 of adult RBC's lifespan only. And their blood volume is 85 ml per kg. And in adult case, it is 60 to 70 ml per kg only blood volume. That is the hematological system. And in the gastrointestinal system, as we told in the initial stage, the sphincters are immature and a high risk of regurgitation, as well as the liver also immature. So if the liver is immature, means there is a chance of physiological jaundice, as well as the liver is unable to detoxify the drugs also. So, and there is increased risk of bleeding will be there, and hypoglycemia also will be there. And one more thing is that actually till 6 months they don't need iron supplements, because it's adequately, even if it is less, it's adequately there. But after the 6 months only, most of the babies require iron supplements. That's in the gastrointestinal system. In the respiratory system, as in the initial anatomically itself told that they are having short nasal passages, and their alveolar sacs are very shallow, and the amount of dead space is very large. That's why they are rapid respiratory. They are having rapid respiratory rate. And they're having large tonsils and adenoids, which will helps in the maintenance of immune system. And their respiratory tract epithelium is very delicate. That tissues are very delicate. There is no mucus protection. That's in the respiratory system. Whereas in case of adult, it is we are having mucus protection, and we don't have much enlarged tonsils and adenoids, and we are having a normal respiratory rate only. And in the urinary system, they are unable to concentrate the urine. These are the main thing in gastrointestinal system, respiratory system, and urinary system. And in the integumentary system, we know that we are having different kinds of endocrine glands, like eccrine, in that eccrine and apocrine glands are mainly in pediatrics. So eccrine sweat glands are very less active in babies, and apocrine sweat glands are small and which is non-functional till preschooler age. Then only after the preschooler age only its function gets starting. And they are having large sebaceous gland also, and they are having fine silky hairs, and the nails are very soft and thin, and they are bristle also. And in the central nervous system, the myelination is incomplete, and as well as the most of the brain connections are also incomplete. And the nerve endings, like to the retina, are not fully developed. So that's why during the time of neonatal period, they don't have vision. Later on only the vision is get developed. Means as the nervous system is get mature only, they are getting the vision also. And their blood-brain, BB means blood-brain barrier. So that is very less efficient up to 2 years. That's why if we are giving an analgesics or an opioids to the newborns or a baby, we should much cautious about this, because we have to give a tapered dose, a very less amount only, because the baby's blood-brain barrier is less efficient. And if you are giving a opioids or analgesics in a high dose, there is a high risk of crossing the blood-brain barrier, and that will reach the brain and damage the neuron system. So that's why if you are giving a painkiller or anything sedatives during the time of a neonatal period or in the pediatric period, you should be much care. And in the reproductive system, their ovaries are 10 mm in length only, and 2 to 4 mm in width only. And testis maturation, which is occurs with the increasing age only. So these are the main differences which we can see in adult, means difference between adult and babies. So important thing is that when we are taking the head size of the thing, we have to take care, like it's a large head when comparing to the body shape. Then they are having small nasal passages. Then their tongue is very large when comparing to the oral cavity, and their eustachian tube is very short and in a horizontal position, and which is more close to the throat also. That's why they are more prone to get upper respiratory tract infections. Then when coming to the stomach or gastrointestinal system, their sphincters are more lax, and there is a high chances of regurgitation or vomiting is there, and their stomach capacity also very less only. Then moving to the basal metabolic rate, they are having high basal metabolic rate, newborns having, because of their rapid growth and rapid energy consumption, and they are more prone to get hypothermia also. Why? Because of their increased surface area, and their hypothalamus is immature. And why they are more prone to get hypoglycemia means their liver also immature, and they are more prone for the physiological jaundice due to the immature liver. And their important thing is blood-brain barrier is inefficient, and we should be much care when giving means everything for this baby. These are the important things you have to keep in mind. First one is size, then the nasal passages, then their oral cavity, then the like sphincters control, all those things only. Then next is factors which is affecting the growth and development. Just simply we can have keep in mind like age, it's biorhythm, race. Means age means, as we know, if they means elderly as well as the late pregnancy, there is a high risk of preterm babies, or the babies may be get and like congenital anomalies, especially if Down syndrome is more means higher incident of Down syndrome is seen in late pregnancy. Then sex means there will be sex difference will be there, like both boys as well as the girls body shape as well as their maturation function also. Then biorhythm, race, genetic factors means is there any genetic disorders, familial history of genetic disorders are there, means there will be chances of transmission is there. And in the race, if you can say an example means when comparing to the Indian with Africans, like Africans have long hands, legs, we know that, and their arms and hips are very narrow and thin shoulders, whereas we are having quite normal. And in case of Japanese means they are having a large trunk and the legs. That's the main difference. If we are taking an example only, that's a race differences. Then there are most of the antenatal factors, natal and postnatal factors like toxins, environmental factors, then the maternal infections or any kind of medical illnesses. All those things are affecting the growth and development of baby. For example, if the nutritional status, if you are taking means, if the mother is lacking of folic acid or iron, that will be affecting the baby. So due to the deficiency of folic acid, the baby may get neural tube defect. And the recent studies which shows that if you are giving a folic acid in the antenatal period, we can reduce the prevalence, incidence and prevalence of cleft lip and cleft palates also. That's one more new arrival. And the hormonal factors like thyroxine, like a deficiency, like thyroxine deficiency means that will retards the skeletal maturation. Then insulin also. If the mother is GDM, like maternal diabetes is there also, means that will affect the baby. Then emotional status of the mother, like if the mother is depressed or if the mother is having any kind of diseases, that will affect the baby's growth. There is a high chance of IUGR. And the environmental factors like for example, toxins and lead, iron, those exposure to those things, and smoking, all those things comes under environmental factors. So some of the factors which is affecting the growth and development only. And next is the rates of development. How will be the development or the growth takes place in each group, like the infants, toddlers, adolescents. So infants and adolescent means fast growing life only. We know that. And the toddler group means till school age, means growth will be sluggish, means slow growth only. And in fetal period and infancy, most the head as well as the neurological tissues, neurological system well developed during the fetal period as well as the infantile period only. And toddler and preschooler or the adolescent, we can say that through the adolescence, the trunk grows more rapidly or fast because of the influence of the hormones. Means the adolescent period is more hormonal factors are coming. And the school age only limbs are growing more fast. So these are the rate of development. So in this, the neurological tissue develops during the fetal and infantile period, and rapid growth or faster growth takes place in infants and toddler period. Slow growth occurs in school age, toddler to school age period. That's the important thing. And next is the measurement of growth. How we can measure the growth of the baby. In that, first one is the anthropometric measurements. We know that so many anthropometric like weight, height, then mid-arm circumference, so many things are there. So some of the things we can just come across. Like the first one is weight. So average weight of a neonates is 3 kg. In Indian scenario, it is told that normal newborn should weigh between 2.5 to 3 kg. That's a normal newborn weight at birth. So as we told in the initial stage, there is most of that is up to 75 to 80% of body is comprised of water. During the first week post of life, like in first week of life, the baby will lose 10% of weight. Means 10% of birth weight. And after 10 days, like once completing the 10 days, he's regaining the life weight also, because in the initial immediately there is a transmission from the intrauterine to extrauterine. So the environmental, there is in order to get adapt to the extrauterine, the child need more time, and their basal metabolic rate is high, rapid growth takes place in, and you need to take protection against the hypoglycemia or hypothermia, all those things. So rapid means more energies are consumed. That's why during the first week, 10% weight loss will be happening. Then the child is regaining the weight, and how the weight gain is means 30 gram per day till 3 months. Weight gain is during first 3 months, it's 30 gram per day, and 4 to 6 months, it is 20 gram per day, and 6 to 12 months, it is 50 gram per day. That's a weight gain. So here important thing is average weight is 3 kg. Indian scenario is 2.5 to 3 kg, and weight gain during the first 3 months, it's 30 gram per day. 4 to 6 months, it is 20 gram per day. 6 to 12 months, it is 50 gram per day. So if you are taking the birth weight as EX, we can calculate like the birth weight doubles at 5 to 6 months. It will triples by 1 year, quadruples by 2 years. At 3 years, it's 5 times of the birth weight, and 5 years, it's 6 times, 7 years, 7 times, and 10 years, it is 10 times. So we can keep it as an like if there is a difference is coming like 7 and 10. From 7 years, it's 7 into birth weight. 10 years, it is 10 into birth weight. So you may have a question from this here, like when the baby's birth weight doubles or quadruples, like that way. The last noset also there is one question was there, like baby's birth weight quadruples at the age, like that way. So we can simply remember like this. And we are having a formulas for calculating the birth weight. We can say which formula. So there are 3 formulas are there. First one is from 3 months to 12 months, we can calculate the expected weight by age in months plus 9 divided by 2. For example, if the baby is having means babies at the age of 3 or 4, 3. So age in month means 3 plus 9. It's 12. 12 by 2, 6 kg. So a baby at the age of 3 months should possess 6 kg. That's the expected weight from 3 to 12 months. Next is 1 to 6 year. So we can calculate age in years into 2 plus 8. Like that way we can calculate. Example, if the child is having but means child is 6-year-old, age in years, so 6 into 2, that is 12 plus 8, it is 20. So a 6-year-old child should possess 20 kg. So you can simply remember these formulas during the time of exam also. And one more, the last formula, from 7 to 12 years, we can calculate the expected weight as age in years into 7 minus 5 by 2. It's simple, but when comparing to these two, it's some kind of complication. Into 7 minus 5 by 2. Maybe sometimes they may be forget, like maybe into 5 or into 7, something like that way. Confusion we having. So from 3 to 12 months, expected weight is age in month plus 9 by 2. 1 to 6 years, it's age in years into 2 plus 8, and 7 to 12 years, age in years into 7 minus 5 by 2. And if the child is, if you don't want these formulas, in simple one, from the age of 2 year to 12 year, you'll have a single formula, like expected weight of babies between 2 and 12 years are age in years plus 3 into 5 by 2. Only one formula. Only one formula is there for 2 and 12 years. Age in years plus 3 into 5 by 2. So these are the formulas for calculating the weight of the baby till 12 years. Next is the length. So at birth, the length of the baby or the height of the baby is 50 centimeter. And once a baby reaches 3 months, it becomes 60. And at the 6 month, 65. 9 month, 70. 1 year, 75. In 2 year, it becoming 90 centimeter, and 4 year, it's 100 centimeter. So the birth length doubles by 4 year. That's the important thing here. Birth length doubles by 4 year. So that's a question. Like when we discussed the weight section also. So at birth, we are having, the baby have 50 centimeter. 3 months, it is 60. We can add 10 at 3 months. 3, 6, 9. Like that way, we can keep in mind. 3 months, it's 6. But once the baby reaches 6 months, 5 only increment. 9 months, 5 increment. 1 year, 5 again 5 increment. But the 2 year, it becoming 90. And important is 4 year birth length is doubles. So after 4 years, the child gains height at a rate of 6 centimeters per year until 12 years. That's the important thing. After 4 years. So till 4 years, we told that the birth length doubles at the 4 year. So after 4 year, the child grow or lengthens. Height increases at a rate of 6 centimeters per year until 12 year. And the height of the adult, which is equal to twice of height at 2 year. So if the child is having 100 centimeter at 2 year, that's a shorter. It should not be like that way. So doubles, the adult height will be doubles of the 100. That's the thing. And the birth length doubles at 4 year. So we can, here also we are having a formula. Beyond 1 year, we can calculate the height of the baby by expected height equal to age into 6 plus 77. That's a simple formula. Age into 6 plus 77. That will give us the expected height of a baby beyond 1 year. So here, after 4 years, child gains height at the rate of 6 centimeters per year till 12 years. Then birth length doubles at 4 years. Beyond 1 year, we can calculate by age into 6 plus 77. So far, any doubts? Anything clarification? Is that clear for all of you? hope it's clear. So next is head circumference. So by birth, the child may be told that child have a large head. So the head circumference is 33 centimeter to 35 centimeter. And how we have to measure the head circumference? These are the important area that we have to take care. That is, if you are keeping the tape, the anteriorly it should be at the supraorbital ridges above, and laterally above the ear, posteriorly over occipital protuberance. So these are the three important areas while taking care of the head circumference of the baby. So it should not go above the level of supraorbital ridges, and it should not be below ear and below occipital protuberance also. So the main important area. And at birth, 33 centimeter to 35 centimeter will be the head circumference. And it increases at a 2 monthly increment till 1 year. Maybe you can have 4 plus 3 plus 2 plus 1 plus 1 plus 1 if possible. Otherwise, you can keep in mind like this. At birth, it's 33 to 35 centimeter. 2 months, it's 38 centimeter. 3 months, it's 40 centimeter. 4 months, it's 41. 6 months, 42 to 43. 1 year, 45 to 46 centimeter. 2 year, 47 to 48. At 5 year, it is 50 centimeter. 12 year, it is 52 centimeter. And adult 54 to 56. Here, you just keep at birth 33 to 35 centimeter. And 3 months, it's 40 centimeter. 6 months, it's 42 to 43 centimeter. That's important. And the chest circumference. So we have to measure the chest circumference at the nipple level in mid respiration also. And how we can measure means, if the baby is beyond 5 years means we can measure in a standing position. If it is less than 5 years means we have to measure the chest circumference in a lying position, and we have to take the cloth also. We should not measure the chest circumference over the cloth. And the chest circumference, which is approximately 2 to 3 centimeter less than of head circumference. That there is a relation between head circumference and chest circumference. That is, at birth the chest circumference is 31 centimeter approximately. And at 1 year, the chest circumference that will be equal to head circumference. And beyond 1 year, the chest circumference, which is greater than that of head circumference. That's the relation between chest circumference and the head circumference. So, in common, you can keep in mind that the chest circumference is 2 to 3 centimeter less than of the head circumference. And the mid-arm circumference at birth, it should be 9 to 11 centimeter average only, and 1 year it should be 12 to 16 centimeter. And mostly we are taking the mid-arm circumference like for the toddler, from toddler age group only, in order to calculate the malnutrition. And 1 to 5 year, 16 to 17 centimeter. At 12 year, it is 17 to 18 centimeter. At 15 years, it is 20 to 21 centimeter. And it's only for nutritional assessment only. We are taking the mid-arm circumference. And how we have to measure is, we have to, particularly it should be, keep the baby's left hand in a, that is, we have to take the length of from acromion process to olecranon process, and we have to take the midline of that. Then we have to circle around. We have to take the circumference of the midpoint. Like that way only we have to take the mid-arm circumference. And one more thing, it also wingspan or arm span. It's more important in case of nutritional assessment only. So it is a distance between the tips of the middle finger of both arms. That is, tip of the middle finger of the both arms. That's the distance between the tip of the middle finger of the both arms when we are outstretched at right angle to the body. This is the body position. And the measurement is, if the baby is less than 5 years, it is ranging from 1 to 2 centimeter less than of height. And 10 to 12 years, the arm span, which is equal to height, exactly like CC and HC. And beyond 12 years, the arm span is greater than of the height. So here the arm span and the heights are related. Less than 5 years, arm span is 1 to 2 centimeter less than of height. 10 to 12 year arm span equal to height. More than 12 year arm span greater than height. And one more thing is skin fold thickness. So this is a carpenter's skin fold thickness caliper. Maybe you make it a image based question. What is this? What is the instrument? So this instrument is used to measure the skin fold thickness. And we are where we are keeping means the left side over the triceps only. We are taking at the area between the index finger and thumb. If you are taking the hands. These are the measurement of growth. And the next one is we can just see on the developmental theories. These are important things, but we have to keep it in mind when dealing with the developmental theories. So there are mainly psychoanalytical theory, psychosexual theory, psychosocial theory, intellectual theory, or cognitive theory, then moral developmental theory and behavioral theory. These are the main important theories. So the psychoanalytical theory means the psychosexual and the psychosocial theories are comprised of psychoanalytical means theory. That is psychosexual developmental theory plus psychosocial developmental theory give rise to psychoanalytical theory, and which is put forward by the famous psychologist Sigmund Freud. So psychosexual developmental theories, father of psychoanalytical theory as well as psychosexual developmental theory is same what Sigmund Freud. And according to Sigmund Freud, personality is having ego and superego. So what is it? It's a pleasure principle. Ego is the reality. Superego means moral principles. That is the main thing. And the Sigmund Freud also developed the personality, just personality development into various stages. That is oral stages, anal stages, latency, phallic, and genital stages. These are the major stages. So first one is the oral stages. That's the age between. Here, what we have to think about oral stage. The age group is from birth to 2 years. Usually, it's say that infantile period only, but it's from birth to 2 years. And their pleasure-seeking areas are oral cavity, that is mouth and tongue only. That is oral gratification is their activity for getting pleasure. Through oral gratification or stimulating the oral cavity, their stress is relieving. And some of the activities they may possess means like feeding, thumb sucking, bubbling, chewing. These are the activities, gratifying activities. And if they are doing the oral gratification means they will relieve. And one of the conflict in this area is weaning, because at the age of 6 months we have to start weaning also. That's a conflict here. And during this age the child becoming means learn to become less independent, like. And if the age is not completed successfully, there is some disturbances occurred means the child may have a little like smoking problems with smoking, alcoholism, drug addiction, nail biting, obesity, difficulty in trusting others. These are the some of the problems which will arise if the person is unable to successfully complete the oral stage. If you are seeing any person's nail biting, you can say that that person's oral stage is not at all completely successfully completed, like that way. Okay, these are the important thing. First one, oral stage, birth to 2 years. The area of pleasure is through oral cavity, that is mouth and tongue. Oral gratification, that will use to relieve the tension or the stress of the baby. And gratifying activities are feeding, thumb sucking, and bubbling, or chewing, biting, anything. If it is disturbed, this age is disturbed, problems with smoking, alcoholism, obesity, nail biting, all these things will occurs. And the conflict in this age is weaning. So if a person is successfully completing the stages of development, means you will get a healthy personality. Otherwise, if any issues like any disturbance or anything is happened, means fixation may occur. Fixation means that person may focus on that particular psychosexual stage. He won't go beyond that. He will stuck on that, or stagnation will happen if it is not yet resolved. So that's important. And the next stage is the anal stage. And the anal stage, the age group is 2 to 3 years. So the age group you have to keep in mind, and the area of pleasure which is deriving from anal area, and they are getting pressure from excretion, that is controlling like bladder and bowel controlling. They are getting pressure, and here muscle control in bladder, rectum, anus provides their sensual pressure. And one of the conflict in this age group is toilet. So by the in toddler age only, this is 2 to 3 year means we know that it's a toddler age group. So toddler age group only we are starting the toilet training, and the toilet training which is depends upon the parents approach, how the parent is approaching the toilet training, how they are training the child. If they are learning, like if they are not strict, if they are giving much like a less strict approach to the toilet training means the child may develop anal expulsive personality. Anal expulsive personality, that is if the parent is not that much strict toward the toilet training, the child may develop anal expulsive personality, that is AEP, anal expulsive personality. Means how it is characterized as the child may be messy or wasteful or destructive personality. That's an important thing. And if the parents are too strict or uh, like or they are beginning the toilet training in early period means the child may develop anal retentive personality, that is ARP, anal retentive personality. How it is characterized as stringent, like overriding or ordering or rigid, obsessive or demanding strict attention or how to follow strict look. Such personality will be developing. These are the two personalities in anal stage you have to keep in mind. First one is anal expulsive personality, anal retentive personality. So toilet training starts. Vigorous toilet training means rebellious attitude. Unsuccessful means problems means constipation, perfectionism, OCD, obsession is happening. Successful means the child may attain bowel and bladder control. That is the success of anal stage. And in the phallic stage means here the sensual pleasure is through a genital region only, and they are learning the sexual identity. That is, they are begin to discover the difference between both male and females, and they are more curious about also. And if they are successfully completing this stage means they become more aware about their sexuality. If they are unsuccessful means there is problems like a homosexuality, transsexuality, sexual identity problem, all those things are happening. And the most important things in the phallic stage you have to keep in mind means Oedipus complex and Electra complex. Oedipus complex means like a boy wants to fix the mother and he wants to replace his father. That's the Oedipus complex. The same thing is happening in the girls means it is known as Electra complex. Like a girls don't want to be close with the mother. She just want to be with the father, and she wants to remove the mother from her life. Like they are attraction towards the opposite sex. They are fixing their boy is fixing their mother and girl is fixing their father. And two more important things in this thing in Oedipus complex, like the boy may have some kind of fears, like whether if he's fixing on the mother means whether the father may get punished or get angry, maybe some kind of fear will be there. That fear is known as castration anxiety. If the boy in the Oedipus complex may develop a fear of punishment by punishing by the father, it's known as castration anxiety. And the same fear arising for a girl is known as penis envy. Fear of being punished by mother. That's it. So these important things in phallic stage, that is central pressure through genital region, Oedipus complex, Electra complex, castration anxiety, and penis envy. And in the latency stage means that the age group is 7 to 11 years. And here they are identifying himself with the parents of same sex because they are identifying the same sex. And their libido interests are suppressing in this age group. And here is more important is to socialization, communication, and self-confidence. And if they are successfully completing means self-confidence, and they will be more social, and good communication skills are developing. And if they feel any problems or if they are unable to complete it successfully means they will lack motivation, inability to conceptualize, they don't have much self-confidence. all those things will happen. So that's the latency stage. And the last genital stage, that is 11 to adulthood. That is it begins during the puberty, and throughout the adulthood period, it is happening. Genital stage is going. So here is a sexual maturity, that they have strong relation or interest to the opposite sex. And the main goal of this stage, what is means to establish a balance in their life. Means adulthood means it's going to be matured period, so they need to get in a balanced state. And if they are unable to complete it successfully, they may be having frigidity, impotence, unsatisfactory relationships. All those things happens. These are the important things. So according to Freud, personality comprised of id, ego, superego. Then the stages are oral stage, anal stage, phallic, latency, and genital stage. Oral stage, oral cavity, and sucking, oral gratification. Conflict is weaning. Problem is nail biting or drug addiction. And in the anal stage, toilet, important thing is toilet training. And in phallic stage, Oedipus complex and Electra complex, castration, anxiety, pain, envy, those things have to be kept in mind. And the latency stage, it's identifying the same sex only. More communication and self-confidence are attaining. And the genital stage, sexual maturity. That's the important thing how to keep in mind. And in the psychosocial development, you just have to keep the important thing, like Eric Erikson is proposed. Psychosocial development is proposed by Eric Erikson in the 1902 to 1904, and he's a German psychologist. And what is he classified into 8? The whole adult from birth to adulthood is classified as 8 categories. That is from birth to 1 year. We know that it's infantile period. So what it happens? Trust versus mistrust. And 1 to 3 year total period. Autonomy versus shame and doubt. Here means trust versus mistrust means we can just correlate with the oral stage. Like if the child is taking care of much and we are giving more love, means the child may develop trust. Irrespective means instead of that, the child is not getting adequate love, or the parents are neglecting the child, means mistrust will happen. And then the 1 to 3 toddler, autonomy versus shame and doubt, means if we know that toddler age group means more vigorous and they are more active in this age group, and they are started to do something newly. So if we are encouraging, means they will accomplish that. And if someone is questioned, or someone is telling it's not good, they may be feel shame, or they may be doubt their talent. That's the thing. So you don't want to go in depth, just to keep in from birth to 1 year infantile period it is trust versus mistrust. 1 to 3 year it's toddler age group, autonomy versus shame and doubt. And next is 3 to 6 years, it's preschool age, that is initiative versus guilt. The same like autonomy versus shame and doubt, they are initiating some activities or some creative things. And if you are giving more freedom and opportunity, means the sense of initiative will develop. And if they may, means if we are making them to feel as a bad, or their activities are not good, means they may feel guilty. That's the important thing in the preschool age. And from the 6 to 12 years is a school age, that is industry versus inferiority. Like school age means some kind of maturation will be there, and child tries to master all the crises. He means when we are coming to the school age also, when we look backward, means we know that during the time of school age we think that I am the master, I am everyone, like that way. So in that time, if you are praising that child, or if you are rewarding them, means they will develop a sense of industry or sense of accomplishment. And no one is there to praise them, and everyone is telling that your activities are mischief, are not good, means they may feel inferiority complex may develop. That's it. And from 12 to 18 years, it's adolescent period, it's identity versus role confusion. And 18 to 25 years, it's young adult, that is intimacy versus isolation. And from the age of actually till 18, we have to keep in mind like identity versus role confusion. That's up to pediatrics. And other things are comes on adulthood. That is 25 to 45 years, it's middle adult. And generativity versus stagnation. More than 45 years, till that maturity, that is ego versus integrity versus despair. So you have to just keep in mind in infantile period it is stress versus mistrust, toddler, these things, age group, what the development happens. These things only you have to keep in mind. This is the psychosocial development. And the next is the cognitive development, which is created by, means put forward by Jean Piaget. He is a biologist, and how he has developed as it's he's telling 0 to 2 years is sensory motor, 2 to 7 years it's pre-operational, 7 to 12 years it's concrete operational, then more than 12 years it is formal operational. So that's according to the Jean Piaget. That's a cognitive development. He's classifying as sensory motor, pre-operational, concrete operational, and formal operational. And the moral development, both Piaget and Lawrence Kohlberg developed the moral development. So according to Piaget, he is telling that 3 to 11 years is a respect for rules, and more than 12 years is a sense of justice. But according to Kohlberg, he's classified as pre-conventional, conventional level, and post-conventional methods. So these are the important things. So to be summarizing, we can keep like according to each age group. That is from 0 to 1 year, it's infantile period, and the psychosocial development means oral stage. In psychosocial, it is trust versus mistrust, and then intellectual it is sensory motor. And there is no moral development. It will be starting from the toddler age group. So 1 to 3 year toddler age group. Psychosexual is anal stage, psychosocial autonomy versus shame and doubt, intellectual pre-operational, pre-conceptual phase. In moral, pre-conventional phase. From 3 to 6 year, that's a preschooler age. Psychosexual development is phallic stage, that is Oedipus complex and Electra complex. And the psychosocial initiative versus guilt. Intellectual means pre-operational intuitive phase. And same thing, that is pre-conventional. And the 6 to 12 year schooler age, it is latency period like in psychosexual, that is identifying the same sex. And psychosocial, it is industry versus inferiority. And in the intellectual, concrete operational and conventional method, that is moral development. And more than 12 years, it's adolescent period, that is genital age group. And psychosocial means the identity versus thought confusion. Intellectual means formal operational. Moral development is post-conventional. This is total summarizing of the both all the theories, developmental theories, including the infantile age group and stages of development also. So you can keep it as an important note point. So if you're taking the growth and development means, what are the things we have to keep in mind? That physical growth, in the physical growth also, I'm just telling the intro only. I'm not going too much deeper. Like if we are going to learn a growth and development means all these aspects we have to cover. Like in physical growth, we have to cover anthropometry, vital signs, teeth eruption, then motor development, sensory motor development, psychosocial development, then psychosexual development, intellectual development, moral development, and language and speech. These are the growth and development areas we have to keep in mind. And in the next class, we can see the important milestones of each age group. So far, any doubt? Anyone need any clarification? Okay, fear of punishment. So in the like phallic stage, if it is like the fear of punishment by father, like if the boy is having fear of punishment, it is known as castration anxiety. And the same thing, maybe the girl child is means it is known as penis envy. Castration anxiety fear is for boys, and penis envy fear is for girls. Anything else? Any queries anyone is having? If no one is having queries, shall we stop the class now? No questions from Ashini K. Thank you. Thank you. Thank you, everyone.